Hello everyone, I am back here with the topic Virechana, that is another procedure of Panchakarma procedure in children, right? So in my last video we saw the Vamana Karma procedure, and in this video we will see the Virechana procedure. Virechana means purgation, that is the vitiated doshas we will eliminate by the adobhaga of a person, that is we can say by motions, by passing motions we will eliminate the doshas, especially in children, as we are dealing with the procedure in a children, Panchakarma procedure in children. Or in Ashtangaradya Uttara Tantra 2nd chapter 33rd shloka, our Acharya Vagbhatta explained as Vastim Sadhyo Virekena, means the Vasti acts as an alternative form of Virechana. Especially this Virechana is contraindicated in a children. Especially in children we will avoid the procedure of Virechana, because however we know the children will be more prone for dehydration, right? So as this Virechana means purgations, continue motions will cause dehydration in a body. Moreover, the babies will be sensitive for dehydration, so they will be more prone to have the complications in a procedure of Virechana if we advise in a children. So usually we will avoid Virechana procedure, but in extreme condition, after applying all the procedures, all the treatment, if babies didn't get cured, then in such conditions we will go for Mrudu Virechana. Example in extreme conditions means, example we can take Krimi in Krimi Roga. If you give Samana Aushadhis also, if didn't get subside, then automatically you should go for Virechana procedure, right? So in such extreme conditions we will advise Mrudu Virechana Aushadhis like Trivritta or Sukha Virechana Aushadhi like Chaturangula can be advised for a children. But basically we will avoid Virechana procedure in children, and moreover wherever Virechana is necessary we can go for Vasti procedure. Though after giving all this treatment, if baby is not getting cured, then you can go for Mrudu Virechana. So now we will see the procedure of Virechana, that is what are indications, what are drug used, and how the management is present in a Virechana procedure. First point is indications. Indications for Virechana procedure is, that is Virechana karma is Pittaja rogas, vitiated doshas in dhatus, asthenia or low motility of sperms. In such conditions we can advise Virechana. Low motility of sperms you will not get in children, usually we will find it in adults. And after gap of 15 days after Vamana, Snehana and Svedana procedures, you can go for Virechana. We saw this explanation in Vamana Karma also, right? For Vamana and Virechana you should have the duration gap of 15 days for the each procedure, okay? And next is age, especially when you can start the Virechana. Usually, as I said in last slide, Virechana karma is contraindicated in children, but if you want to advise, you can advise Mrudu Virechana, that too when after 4 to 8 months you can advise Mrudu Virechana. And next point is drug used. What all drugs you can use in a Virechana karma, that is Trivrittasthaka Churna means Trivritta Churna, Dhanti, Shyama, Vacha, Kampilla, Neelika, Saptala and Vishani. One or all of them with sugar can be used for the procedure of Virechana. Any one you can choose in this list of drugs, or you can all the drugs with sugar for the procedure of Virechana. And in cases of, if well snigdha person is there, means body is well snigdha, then you can go for Ruksha Virechana. And in case of Ruksha body, some will be having Ruksha dry body, right, dry skin, for them you can go for Sneha Virechana. There are two types of Virechana, that is Ruksha and Sneha. You can choose according to the prakriti of a body of a person. Next is dose. Dose, how much you will give in the form of for the procedure of Virechana. 1 to 2 karsha, that is half pala. Boil in 1 or 2 prastara of water and give with gomutra. 1 or 2 karsha of medicines powder with sugar you can take, and it should be boiled in 1 or 2 prastha of water, and then you can give with the gomutra. How much quantity you should give? You should give half quantity of that of Vamana procedure. In Vamana procedure, can you remember how much quantity you will give for the person or a patient? 4 anjali, right? 4 anjali in Vamana procedure. Here half of that, that is 2 anjali. Quantity of Virechana karma is 2 anjali. You should advise to take orally as a medicine. And administration, how you will give? For children there is special vessel, that is adukena payayet. Special instrument is there, special vessel is there for children. Or you can give with mixed with Navanita. Mixed with Navanita also, this 2 anjali medicine you can mix with Navanita and you can give for a person. Or by applying on nipple or areola before 8 months. Before 8 months means for Kshirapa you can give with the applying for the nipple of a breast or areola of a breast. You can apply the medicine and you can give for the baby indirectly. And Vegas, how much you should get after the procedure, I mean the motions, how much Vegas you should get. Again it depends on 3 persons, right? According to their digestion capacity, avara, madhyama and pravara, you will get Vegas. But as we are dealing with children, in adults you have particular Vegas, but in children you should go along with their Prakruti or along with their body. Next point is about management. How we will manage the person after completion of procedure, right? Management is give dhumapana, follow samsarjana karma like peya, yavago, etc. in 3 annakalas each, and give hot water to drink and wash hands. Nothing but you should keep warm. And if atiyoga lakshanas are there, then you can treat the person as a atisara disease. But in cases of atiyoga of shodhana of procedure, Virechana procedure, then give ghee to drink or give anvasana vasti with madura aushadha siddha taila. In cases of atiyoga of Virechana karma, then you can give ghee to drink or you can give anvasana vasti with madura aushadha siddha taila, you can go. This was about the management. Then our next point is results. For every procedure there will be results, right? But if coming for results, we can't accept the good results or samyak results in all persons in all procedures, right? There will be having 3 forms of results, maybe atiyoga or ayoga or samyak. Means maybe the dose will be excess complications, or maybe the dose will be low or without any effect, and the good results. In the form of 3 results we have to see the procedure or any treatment, right? So in which form of situation which lakshanas will be present in a person, especially if you gave the correct procedure way and if the person had the good result, then last vega, last purging should end with the white and transparent kapha. And in samyak lakshanas, persons will be having amashaya, pakvashaya, guda and pitta are in normal condition, and there is appetite, increase in appetite, vata, mutra, anulomata and laguta will be in a person in samyak lakshanas. And in ayoga lakshanas, vomiting, difficulty in micturition or defecation, aruchi, admana, gurutam and pratishyaya, jvara. These all will be present in a form in the person of atiyoga lakshanas. And last one is sorry, in ayoga there will be vomiting, difficulty in micturition and or defecation, aruchi, admana, guruta, pratishyaya and jvara. These all will be present in ayoga lakshanas. And in atiyoga lakshanas, there will be hampers in doshas like kapha and pitta will decrease. So automatically the vata increase. Prakopa of vata will takes place in atiyoga lakshana, and tamha pravesha murcha, shula, vata vikaras, gudabhramsha, nidranasha, unmada, angamarda, klama and kampana, hikka. These all lakshanas will be present in a person who is having atiyoga lakshanas. These three are the form of results, that is samyak lakshanas, ayoga lakshanas and atiyoga lakshanas. So this was about the procedure of virechana held in, that is panchakarma in children. I am not explaining about the adults procedure or results or dosage everything, only I am explaining about the panchakarma in children, right? So I am explaining shortly all the procedures in the form of children only, which are applicable for children, and how we will use these procedures in a children. I am explaining it. If you want the adult procedure, then please go through the textbook and classical explanations, but I am explaining only about applicable in a children. Okay, thank you.